Hey guys, it is another episode of Disease of the Day on this very cold day. I don't know where you're located, but where I am, it's freezing. And it's a perfect day to talk about hypothyroidism because one of the main signs of hypothyroidism, one of the main symptoms is you're cold. So, perfect day to talk about it. So, what is hypothyroidism? And it's pretty common, it's probably one of the most prevalent diseases in the US. We all probably know somebody, if not ourselves, that have suffered from it. And it is basically just a failure of the thyroid gland to produce enough thyroid hormone to meet the body's demands. It's that simple, and how does it show up? What do these symptoms look like? Well, these symptoms are pretty common. Most of us know what they are, but I'll go over them again. We're talking, fatigue, weakness, depression, constipation, hoarseness of the voice. Weight gain is really common, memory loss, inability to concentrate, cold hands and feet, like I talked about before. That is a really big sign. Also, an intolerance to the cold. People who have hypothyroidism just can't handle the cold as well as other people. They tend to have dry skin, thinning hair, swelling, especially around the ankles, headaches, things like that. And it also starts to affect the sex hormones. So that's where you're also going to show up noticing period irregularities, decreased libido, the fibrocystic breasts in women and men are going to show up with erectile dysfunction potentially. So when they come to me, how do I know that hypothyroidism might be something that we need to discuss and kind of dive into and look at? There are physical presentations that also show up. So one is the delayed Achilles tendon reflex return. So if you've gone to the doctors and they hit your knee and they hit the back of your ankle, your Achilles tendon, to test your reflex, if you are somebody that you don't ever seem to have a reflex return, that's a potential for hypothyroidism, especially the one around the ankles. Something to think about. They tend to have very dry, coarse skin and hair. Another interesting one, which is really common, is a slight orange tinge to the skin, specifically on the palms of the hands and the bottom of the feet. So that is because there's an accumulation of beta carotene in the skin, and it really accumulates a lot in the hands and the feet. And that's because when you have hypothyroidism, your body just has an inability to really convert the beta carotene to vitamin A as efficiently as it would normally. And that's where you're going to see that nice, beautiful orange tinge that you see in some people. Another kind of sign that'll tell for me is the outer corners of the eyebrows. They can be very, very, very thin to almost non-existent if you have hypothyroidism. And also lastly is the swelling, and it's a non-pitting edema, and especially in the ankles. And that's non-pitting edema. We've all seen the edema, like when you have swelling and you stick your finger into your body and it kind of leaves like a hole after. That would be pitted edema, right? This doesn't have that pitting. So it just is kind of a general swelling overall. And you really notice it around your ankles, and you'll notice it as bags under the eyes. That's another spot. So what happens? You go to the doctor and you're showing all of these symptoms and these physical presentations, and they say, you know what, I think we should draw your blood. They draw your blood, and what they're going to check for is they're going to look for a decrease in your T4 and your T3 and increase in your TSH. That shows a clinical, presentation of hypothyroidism. If that shows up, they're going to basically write you a script for Synthroid or some other hormone replacement therapy, and they're going to send you on your way. So there's a couple problems with that. One is there's subclinical hypothyroidism, and that occurs a lot of the time too. And what does that mean? That means that you can show up with all those symptoms I talked about, those signs that are straightforward that you have, potentially hypothyroidism. They draw your blood, and the blood work all comes back within this normal range. So now the doctor is put in a precarious situation of, do they want to treat, even though it's considered normal, or do they not want to treat? And a lot of times they don't, because it's not warranted. If you were to look at the blood work, it doesn't warrant a prescription. So this conventional approach to me has two weaknesses. Okay, one is the lab tests, as I said, they can kind of fail to detect the hypothyroidism, and you can be subclinical. Well, it would be fine if that was a small percentage, but it's 80 to 85% of the time. So 80 to 85% of the time, the lab tests fail to detect hypothyroidism. You are actually a subclinical level, and it's getting missed. Well, that's a problem. And two, say you do show as clinical, those levels are off, and they give you the prescription for hormone replacement therapy, is that a significant amount of people have little to no improvement when they're on it. And those symptoms, they don't seem to reverse. So you show up and you've had significant weight gain, your muscle aches, erectile dysfunction, the intolerance to cold. You start taking the Synthroid or some other hormone replacement, your blood level goes back to a normal range, but you still haven't lost any weight. You're still freezing. You still have the headaches, you still have the erectile dysfunction. All of this stuff is still present. That seems like, then why are you taking the medicine, right? That was always my question, is then why are we taking it? And there's a couple of reasons why the medication may not be working exactly the way you want. One is, if you are taking the medication around the time you're eating, it's going to mess with the absorption. And a lot of people don't realize that if you are eating anything with calcium, iron, magnesium oxide, or soy, they have all been shown in research to really inhibit the absorption of the thyroid hormone. So if you take that medication less than an hour before or 2 to 4 hours after you eat, you're going to have a problem with absorption. So let me stress again, if you are taking a hormone replacement for the hypothyroidism, you need to make sure you're taking that medication at least an hour before or 2 to 4 hours after you eat. Because I don't know about you, but almost every meal I have is going to contain calcium, iron, magnesium, and if you buy anything packaged in the United States, it probably contains soy. So you want to be very careful when you're taking this medication and around the time that you're eating. Secondly, the problem is, why is it so prevalent and showing up, and why is nobody taking a look at the cause? And I think that's, to me, a very big problem because, again, as I said, we all know somebody who has hypothyroidism, if not ourselves. This is a very large problem that needs to be looked at, and we need to be figuring out what is the cause of that. And why is it so prevalent? Because of that exact reason. And so, that's also why we're not seeing a reverse in the symptoms. So when you're taking the medication and your levels now go back to normal and you're supposed to be perfectly wonderful, feeling great, and you don't, there's a reason for that, because what the actual cause was still isn't being taken care of. That's why you're not losing weight. That's why you still have the headaches. That's why you still are freezing cold, is because the original cause of all this isn't being looked at. So what is that? What that is adrenal fatigue. The adrenals are on overdrive. So the adrenal glands really work hand in hand with the thyroid. And I always like to say they're kind of like the boss. I always feel like if anything's off with the adrenals, the other hormones in your body get out of whack. The insulin, the sex hormones, thyroid, they get out of whack. Cortisol is produced, and it's a stress response hormone from the adrenals. And so if when you're living a very stressful life and a stressful day to day, the adrenals, they get tired, right? So we live in a society where we, most of the time, wake up to an alarm that scares us awake. So now we go into fight or flight, even though we don't realize it. And it then goes to rushing to not be late for work, traffic on the way, getting in, having a stressful job, dealing with children, dealing with family responsibilities, after school sports, birthday parties, you name it. And then you're staying up too late at night and you're not getting enough sleep. So that's fine if we only did that once or twice, but we're doing this on repeat for years. We are dealing with this constant stressful lifestyle basically on repeat. It's Groundhog Day. Every day we wake up and we do the same thing. And then we act shocked when our body, when we're in our 30s and 40s, says, I'm tired. And things start to show up and not work as well as they should. Because we need to take a step back and we need to actually allow those adrenals to relax, because the adrenals are very smart and their main job is to protect you. As anything else in your body, its job is to keep you alive. And if the adrenals get so tired and you don't take time to give them a break, they're going to make a break for you. They're going to make you relaxed. That's where those symptoms of the hypothyroidism show up. They're going to make you tired. They're going to make you, have muscle weakness. So you don't want to push yourself. You don't want to exercise. You want to relax. You want to stay still, because the adrenals need that. And so they're very smart. And so when you don't take the time to take care of yourself, they're going to do it for you, right? You have to look at it that way. So if you really want to start feeling better and you want to take a look at this hypothyroidism and what you can do to increase, the reduction of symptoms, increase, that feeling better, just the weight loss, all of those other things that are going on, those symptoms that kind of go hand in hand with hypothyroidism, you want to take a look at the adrenals. How do we let the adrenals relax? Well, we kind of slow down. We remove some of that stress. We allow our body to not be in this heightened state of stress all the time. So what do? Well, we incorporate meditation. I talk about this a lot. Even 5 to 10 minutes of meditation worked into your daily practice is going to help the body relax. It's going to help the adrenals relax. It's going to mediate the stress response. Learning about breath work. I talk about this a lot too. If anyone wants to learn about breath work, I love to talk. I have a lot of great breathing techniques that are really, really powerful at, kind of tricking the brain to thinking you're relaxed so that the, fight or flight switch can actually get shut off and your body can relax. It can go into a relaxed state, that rest and digest state. Getting a good night's sleep. A lot of people don't do that. Majority of the people that show up to me, they're not getting 8 hours of sleep a night because of their lifestyle, because of their life is so hectic. They aren't able to get that in every day, right? Supplementing with, healthy foods, clean from the ground foods, whole foods, not processed, not fast food, because that also stresses the body out. It's a lot of stress to put on the body when you have fatty fast food that's processed and full of junk. When you start eating cleaner foods that are more whole as they would come out of the ground, the body knows how to process that. It's less stressful on the body. So at the end, my suggestion is if you really want to work on the hypothyroidism symptoms and you want to reverse them, you want to feel your best, what you're going to do is you're actually going to focus on the adrenals. You're going to focus on relaxing. And what are you going to do? As I said before, you're going to meditate. Bring that into practice every day, even if it's only 5 or 10 minutes, right? You're going to start learning about breath work. You're going to work that into your day. And there are so many breathing techniques that you can do that nobody knows you're doing them. You can do them in a meeting. You can do them in the car. You can do them anywhere. Nobody knows. It's going to be changing your nutrition, eating less processed fast food, less crap, more natural food, more whole foods. And lastly, if you are somebody who suffers from hypothyroidism with low blood pressure, so if you're one of those people that when you get up in the morning, you're dizzy, if you get up too fast, if you're in the shower, if you bend over in the shower, you're dizzy, it's too much with the steam. If you find yourself just very, very dizzy, that's where you're going to want to actually start incorporating licorice into your diet. That is a really easy fix to help somebody who has hypothyroidism with low blood pressure, because that's a sign the adrenals are extremely fatigued. And the licorice is actually formulated for that. Licorice is beautiful. It's like nature created this beautifully to help you out. Have some licorice tea, have a piece of licorice candy, because what it does, it actually increases your blood pressure a little bit. So if you're somebody with high blood pressure, this is not for you. This is for the hypothyroidism, people who have low blood pressure. And trust me, they know who they are. They almost pass out every couple days because they move too fast. That's where you're going to want to incorporate that licorice tea. So if you do that, along with the other things that I spoke about, you're going to notice a difference. You're going to notice those symptoms reversing. They're going to be lessening. You're going to start feeling better because you're taking care of yourself and you're allowing those adrenals to relax. And that is really the main cause that is triggering this hypothyroidism. And you wanted to take a step back and you want to look at what's causing that stress, how long it's been going on. Is there any way to start removing some of those stressors from your life? So I'd love to hear what you think. Love to hear your comments. I also, if you have any suggestions for other things to talk about, leave them below. You can reach out to me, erinbakerhealth.com. I take appointments. We have group classes. Start diving into natural health and how you can take care of yourself on a more natural, easy level that we all can be doing. And have a great day, guys.